My name is Wellington Chiriboga Ramirez, and my topic of today is the transient ischemic attack. The transient ischemic attack is when there is an absence of blood supply to the brain for a short period of time that may be caused by blood clots or injury, narrowing of a blood vessel. Now we have our first video.
Primary prevention of stroke requires the management of atherosclerotic risk factors, such as hypertension, diabetes, smoking, and dyslipidemia. As the risk increases, secondary stroke prevention factors include identifying whether or not the patient has suffered from prior transient ischemic attack, stroke, coronary artery disease, peripheral vascular disease, asymptomatic carotid stenosis, or atrial fibrillation. All patients with ischemic stroke or transient ischemic attack should be on antiplatelet therapy or ASA for secondary prevention of recurrent stroke unless there is an indication for anticoagulation or a contraindication to ASA. Anticoagulation long-term with warfarin is the superior antithrombotic if atrial fibrillation or other definite cardiac source of embolism is identified as the cause of stroke or TIA. Surgical intervention is very effective in the prevention of stroke in symptomatic severe internal carotid artery stenosis. Earlier intervention yields greatest benefit.
The applications in medicine is that with it we are going to try to reduce the amount of patients with ITA and take a better control of prevention programs. Our second video now. There we have the parts of the carotid artery, how the blood is coming to the brain from the aorta, from the carotid artery. As in all, we have pros and cons. In the pros, we have that if we have knowledge of the symptoms to detect the disease as fast as possible, and these symptoms are confusion, weakness, numbness, paralysis, slurred speech, and change in alertness. And in the cons, we have the risk factors that complicate everything: high blood pressure, high cholesterol, arterial fibrillation, and smoking.
Anyone who suffers a transient ischemic attack, or TIA, has an increased risk of stroke or acute coronary syndrome during the following year. Previous studies have estimated this risk to be about 12 to 20% during the first 3 months. The risk of stroke after a TIA can be estimated using the ABCD squared score, which is based on age, blood pressure on presentation, clinical findings of unilateral weakness or speech impairment, duration of symptoms, and presence or absence of diabetes. Urgent evaluation within less than 24 hours is recommended when the ABCD squared score is 4 or more. Has this recommendation for more urgent management of TIAs led to a reduction in the risk of stroke or acute coronary syndrome? The current study assessed over 4,700 adults from 21 countries who were enrolled in a stroke registry between 2009 and 2011. These patients had had a TIA or a minor ischemic stroke within 7 days before evaluation by stroke specialists in a dedicated TIA clinic to expedite diagnosis and treatment. The patient's mean age was 66 years, and 70% had hypertension or dyslipidemia. More than 87% of them had sought medical attention within the first 24 hours after the onset of symptoms. The incidence of the composite primary outcome of cardiovascular death, non-fatal stroke, and non-fatal acute coronary syndrome was 6.2% at 1 year. Most of the ischemic strokes observed during the year of follow-up occurred within the first 90 days. Higher ABCD squared scores, multiple infarcts on imaging, and large artery stenosis were each significantly associated with a higher risk of subsequent stroke. Thus, the risk of cardiovascular events after TIA was lower than previously reported. A higher ABCD squared score, large artery stenosis, and multiple infarcts on imaging identify patients at higher risk for recurrent strokes within 1 year. Full study results are available at nejm.org.
And finally, we have the conclusion. In the conclusion, we have that 1 in 3 people have a stroke within 1 year of having a TIA. After a TIA, you are 10 times more likely to get a stroke in the future. And that's all. We have finished. Thank you.